Hello everyone, I'm Kote. Today we're going to talk about shock. Shock is vascular collapse and widespread hypotension. It's very important to remember it's vascular collapse. Massive vasodilatation, every blood vessels are dilated, it is characterized hypotension. Hypotension means less blood to the main organs. Less blood to the main organs means hypoxia. If it's prolonged, it means infarction of internal organs, and if this hypoxia is not reversible and it will be prolonged, it will cause death of infarction of internal organs. It's important to remember there is reduced blood volume, reduced cardiac output, and vascular tone, and we get shock. There are several types of shocks. Cardiogenic shock. Cardiogenic shock is when pump failure, cardiac pump function is destroyed and failure. It may be massive, may be caused by massive infarction or arrhythmia or wound and cardiac tamponade, and it's characterized cool arms, cool legs, and dry eyes, dry nose, and dry mouth, and altered level of consciousness. It's first type of shock, cardiogenic shock. Second type of shock is hypovolemic shock. Hypovolemic shock is when somebody lost blood first or water. Blood loss during trauma or any other cause in which there is loss of blood, and massive dehydration may be caused hypovolemic shock. This loss of water, loss of fluid, for example, is when there is burn of skin, and there is enlarged area of burned area, and increases loss of fluid. Third type shock is septic shock. Septic shock is the most common form of shock, and it develops when there is septicemia, there is bacteria or viral infection in the blood. These bacteria, for example, and most common is gram-negative bacteria, releases polysaccharides. These polysaccharides increases release of interleukins, and these interleukins causes vasodilation, so there is septic shock. Fourth form is neurogenic shock. Neurogenic shock may be developed for pain, for example, spinal cord injury, for with anesthesia. There is neurogenic vasodilatation and neurogenic shock. And 5 is anaphylactic shock. Anaphylactic shock is type 1 hypersensitivity reaction. We know about it. for any allergy and any allergen can cause anaphylactic shock if it's if this reaction is potent, and may develop anaphylactic shock, generalized vasodilation. Signs and symptoms: dry mucous membranes are typical, reduced skin turgor, prolonged capillary refill time, weak peripheral pulses and cold extremities can be early signs of shock. And there may be several different signs and symptoms of shock, and but these dry mucous membranes, weak peripheral pulse, cold extremities, its most common symptoms, so they are represented almost all cases. And management depends on its reason, but oxygen supplementation, intravenous fluids are very common management forms. Passive leg raising when we have no any emergency or any medical equipment, this most easy technique. And it's important to keep person warm and avoid hypothermia. Medications, vasopressors are used, for example norepinephrine, dopamine, dobutamine. For example, in anaphylactic case, anaphylactic shock, drug of choice is norepinephrine. Let's summarize our speak about shock. Shock is vascular collapse. It's very important to remember. Widespread hypotension, reduced blood volume, cardiac output, vascular tone. There are several types of shock: cardiogenic shock, hypovolemic shock, septic shock, neurogenic shock, anaphylactic shock. And there is 3 types of shock. First phase is reversible, second is irreversible, and third is death. First, compensate, or another form is compensated, uncompensated, and third is death. First 2 form is reversible, and first 2 form is manageable, so we can cure this patient. But if there is third phase, it's irreversible and patient will die. Thank you for watching. Please subscribe my channel, please like videos. Thank you very much. Bye.